Well, economic development leaders in the northeast part of the state say Indiana is fertile soil for the development of health-focused Internet of Things technologies. And Fort Wayne is leading the charge. Business of Health reporter Kylie Valletta tells us about the new Indiana Connected Health IoT lab. Kylie.
Thank you, Gary. Health IoT is opening up a world of possibilities in medicine. When connected to the internet, ordinary medical technologies can collect valuable data, enable remote care, give more insight into the effectiveness of a treatment, and that's just a short list. A $750,000 grant is launching the Indiana Connected Health IoT Lab. Joining me to tell us more about the network is Mike Fritsch, the lab's program manager, and Dr. Michael Miro, Chief Academic and Research Officer at Parkview Health. Thank you both for coming to the show.
Thank you.
Thank you.
Mike, we'll start with you. This grant from the U.S. Economic Development Administration, it could have focused on any economic cluster. Why is health IoT a good focus for Indiana?
Well, first of all, digital health is supposed to be one of the largest components of IoT. And secondly, Indiana has a lot of health-related businesses and markets, including insurance, healthcare companies themselves, medical devices, orthopedics, and pharma. So it's just a natural place and a good place to get a lot of benefit.
Give us an idea of the actual function of the lab. What is it going to do?
We're going to be a convener of companies, of resources. So we're going to be a place where you can learn about health IoT, work and meet with other companies, develop relationships, create testing environments. And so you can learn what it is, test it, try it, and do it, and build companies right here along with getting money.
Right. And Dr. Miro, health IoT connects to a lot of different sectors. Why is it important for healthcare companies in Indiana?
Well, there are many companies that are generating physiologic data from patients, and that needs to be connected to the electronic record in the health systems and then message to patients. So we have a project specifically around implantable defibrillators and pacemakers that we've been doing for the last 5 years, and we were the first organization to do this in the world, where we connected patients to their implantable device data. These devices are remotely monitored wirelessly. The data is sent to a server that the company has, but then it could be routed back through a secured system, and the patient can have access to their data. This will result in patient engagement and patients taking control of their own chronic disease and improving their care.
And can you tell us just a little bit about some future projects, what might be in the pipeline?
Well, we have one that is in the pipeline regarding medication adherence, where we're connecting the patient to information that's generated from a cellular-enabled pill bottle that we can tell when the patient takes the cap off the bottle to see if they took their medication. And it's also connected to a data feed from SureScripts, which adjudicates electronic prescriptions in the state of Indiana. We can tell when the patient goes to the pharmacy to get their medication refilled. So we can message the patient if they did not show up to get their medication refilled. We can also ask the patient why they didn't take their medication, so we can improve their adherence. And of course, 100% of medications administered for a reason to treat a disease, if they're not taken, aren't effective.
And
so we want to improve clinical outcomes.
Absolutely. And this is virtually based in Northeast Indiana and Fort Wayne, but this is not just a Northeast Indiana project.
Well, no, it's starting in Northeast Indiana, and it's physically located in the Innovation Center up there. But we also want to get the rest of the state involved on all the state, and eventually we want to grow past Indiana and get interest from companies across the country and across the world, and have them attracted to Indiana because of this capability.
So what's your focus on right now? You're about 6 months in. Where are you?
We've just gone through a lot of planning, a lot of setting things up. So we're ready to basically launch now, and our first step is really letting companies know and engage with them. So if you're interested in anything close to what we're talking about, we want companies to call us and engage. That's where we're at.
All right, very good. Well, exciting turn of events for Fort Wayne. Keep us posted on the development.
Thank you.
Gary, back to you.